Hey there, everybody. Welcome to the first episode of the Waismann Method podcast. This is from the Waismann Method, Advanced Treatment for Opiate Dependence. You may or may not be familiar with our treatment strategy, our treatment clinic, but we are excited to be able to come to you to talk about medical treatments and medical detoxification for opiate dependence. In fact, that's going to be our topic today. The format that we're going to follow for this podcast is putting out information about recovery from dependence and recovery from symptoms of addiction through the medical treatment medical model. This show is going to be hosted by myself, Dwight Hurst, and Clare Waismann, the founder of the Waismann Method. She's going to come on and answer questions that I'm going to bring to her, many of which will be submitted by listeners, as well as just general questions that have come from the working in the treatment community and being around recovery. Claire has a wealth of experience and is able to pioneer the use of medical detoxification, especially rapid detox, but that's only a part of the approach that she brings to treatment. Today, we're actually going to be talking directly about how Claire approaches treatment and what she does at the Waismann Method Clinic and Hospital to help people get through the medical process of detoxification and start on the road to sobriety. So really excited to be here with you, Claire. I'm actually excited personally to learn more about the rapid detox as well. Because that's a big thing that sort of stands out in your method, right?
It is. It is mostly what we do, but not all we do. Because patients are very different, and so is their needs. Clinical needs, their health, their emotional needs should be tailored to the patient. That's one of the major differences of the Waismann method and addiction treatment. We don't focus on addiction. We focus on the human being that is suffering from the addiction.
What are some ways that approach makes things different for you?
I think when people say treating addiction, they're talking about a set protocol that should fit for everybody. They are talking about a condition. The root of that condition is very different person to person. Treating the condition is just putting a Band-Aid, a temporary Band-Aid. The root of the issue is still going to be there. So when people say, well, relapse is part of recovery, it has to be part of recovery because the root has never been treated. The consequence of the untreated condition will surface again. And that's what addiction is. It's not the issue itself, but a consequence of an issue that has not been properly treated.
I remember hearing a long time ago the idea that addiction is not a problem, it's a solution, right? And if we don't look at it that way, you take someone's solution away, now they have a problem, the same problem that got them there in the first place.
People receive treatment. How people receive care is also very different. The way we receive love, the way we understand and perceive, others trying to help us is so different. So what we are able to absorb as treatment is also very different.
It becomes difficult to accept help then when we're in that perception or that place of addiction.
Correct. Few issues with that. Number one is not being emotionally present. When we are not completely off the drug that is numbing our feelings, it's very hard to make assessment of what the issue is, what the mental health issue is, what the emotions that you're trying to mask is, because the drug itself is causing you to mask those emotions. So how can you see something you're trying to mask?
Do you see people focusing on the behavior that comes from the addiction? I mean, I'm thinking like loved ones and family members who get burned out, and then the patient over and over before they ever come into treatment has been told, oh, you're a liar and you're a criminal or you're this bad person, and they internalize that, and that can become an obstacle.
Oh, of course. Number one issues with, the stigma and the rules, the sayings of addiction is you're always going to be an addict. I mean, if you're always going to be an addict anyway, and you're always going to be, considered one, why should you try to be anything different?
Yeah.
If that's how you're going to stay. So you're making people hopeless by telling them that. The same as a child that misbehaves, and if you tell them, you're always going to behave like this. It doesn't matter if you behave really nice today, tomorrow you're still going to behave like this. I think it makes people hopeless. You're always going to feel like a misfit in society. If I break your legs and if I tell you you're a disabled person that will never be able to walk, how do I expect you to get anywhere?
Yeah, you catch your child taking money from a purse or a drawer in the house, do you tell them, hey, don't take that money. Let's talk about why we shouldn't take money and what's going on. Why did you need the money? Or do you say, don't be a thief? You're a thief.
Exactly.
And,
exactly.
now you've taught them
So
to be a
the
thief.
question to the child should be not just why you're taking the money, but why do you think you could not have come to me and asked for what you need? You know, what's missing there?
And even
What is the
accepting
issue with our relationship?
Yeah. Well, exactly. And accepting that there's a responsibility and a context to the relationship that isn't just the kid's fault. To say, have I communicated
Correct.
that you can't come to me? Or, is there a reason why you've internalized that? I think it's a really powerful approach. And it becomes sort of a controversy in addiction treatment. I've seen people who really embrace the title of addict and some who don't. Some, in fact, I know some treatment programs don't even like the use of the word addict.
Correct. But this is the last few years.
Mm-hmm.
Things have changed slowly. Now, with that said, we treat a lot of people that have been in the 12-step program for 20 years, 30 years, and they've been sober for 20 years or 30 years, and then something happened. But because that's what they believed for the times they stay sober, I don't know how productive it is to break that belief, because that's all they have to hold on to.
I always, when I worked with patients, I like to try to learn a little bit about how do they define that term, and is it a healthy, productive definition in their own head, or is it a shame-based? And I think to your point, I think that's a big difference as far as how is it served to them.
I think it's almost a missed space. I don't belong anywhere else but in that room. Do you know what I'm saying? Nobody else in the world. I feel lesser than everywhere else other than in that room.
Well, and if I feel less than, why would I be sober?
Correct.
Yeah.
We're talking a lot about behavior, but the other issue with addiction to drugs or alcohol is it changes the chemistry in your brain. Actually, it changes your whole metabolism. So obviously, it changes how you make decisions. Replacement drugs are keeping people in that space where they're almost robotic.
Do you find that in the Waismann method, you don't recommend maintenance drugs like Suboxone or methadone?
Again, we don't recommend or not recommend. Every patient is different. If the patient is in an environment where they are using a tremendous amount of heroin, fentanyl, it's not a patient that is in a safe environment to be completely detoxed yet. Then if they have to be in something like this for a short period of time until a safe environment is found,
so it's
I'll tell you.
Really a case of individual treatment planning is what you're talking about. Isn't it funny that should be a radical approach? You'd hope that it wouldn't have to be.
Exactly. It's sad. It's not even funny. It's sad. Yeah. But it's a pharmaceutical world, Big profits are made on long-term treatment and not solutions. So I think anybody, period, can be medically detoxed without suffering or going through, the misery of withdrawal, managed through detoxification, and then have a strong mental health assistance, psychotherapy, a psychiatrist, whatever that is. And with a productive life, I think they will do much better.
Mm-hmm. Tell me a little bit about what happens to me. Let's say I walk in to the Waismann method. I'm going to assume that I have an appointment. So I walk into the clinic. Mm-hmm. What are some of the first things I'm going to run into as a new patient? How does that work?
So before you even come in, there is a preliminary intake that is done. Assessment to know if you are a candidate, because we're not a dual diagnose facility. We don't want to extend the treatment for people that we believe we can't help, and B, this is not the best option for them. So once the patient is here for treatment, they arrive at full service accredited hospital. There is a comprehensive health evaluation. In other words, we're going to check their heart, their liver, their kidneys, make sure none of the major organs have been compromised. And you would be amazed the amount of times we find medical issues they were not aware of. When you're taking numbing devices, your physical response to medical issues are not the same So the whole point of opioid is so you don't feel pain. Our body issues by providing discomfort. You can't feel the discomfort, you don't know there's an issue.
Yeah, no, that makes sense. And then there's also the lack of self-care that goes along with that, too. I imagine that
Correct.
not just the direct damage of the drugs, you're talking
Correct.
about, the secondary effect of bad health management as well.
And these drugs are dehydrates your whole system. Most of our systems function with fluids. So that first day we do an evaluation, we start hydrating the system. We start giving the patient what they need. So after detoxification, the transition will be a lot easier on them.
So a lot of this is pre-detox as well. It sounds like there's quite a bit of prep.
This is all pre-detox, especially if it's anesthesia detox. We need to make sure that the patient is where they need to be before detox starts.
I imagine that's a pretty harsh blow to the system anyway, to go through the rapid detox.
That's the funny thing. Yes and no. I think any detox is harsh on the system. Now, let me ask you a question. Do you think is harder for the system to be under sedation, same sedation you would have if you went through a colonoscopy or oral surgery, for an hour to an hour and a half in an ICU of a full service accredited hospital, or to spend 5, 6, 7 days vomiting, having diarrhea, high blood pressure, rapid heart rate with no medical assistance?
I'd go for option one personally. I've known a lot of people who've gone through number two.
To you. When people say, "Oh, rapid detox is a dangerous procedure," it's almost humorous to me. Is it not dangerous to have no medical recourse? In California, you are not even allowed in most rehab centers to check blood pressure.
Really? Oh, that's interesting.
So you get these patients vomiting, having diarrhea, dehydrating with high blood pressure, rapid heart rate, and no medical recourse. How is that not dangerous?
I knew of a campground in one area that was basically just sponsored by volunteers who just said, you can come here and detox. And they had little huts that you could use. It was essentially like camping with a bucket and a blanket. And that was terrifying when I heard about that, also because of the medical danger that people can get into too. So I can definitely see the advantage of being medically monitored. And tell me again about the timetable there, as far as how long does it take to be actually medically detoxed in this process?
Again, there's the difference. So the patients that are candidates for rapid detoxification are the patients that we, on the second day. So the first day, they go through that whole evaluation, preparation, and the second day, they're transferred to the ICU, where the rapid detoxification happens in usually less than an hour and a half, sometimes even less than an hour.
Wow.
Because what we're doing is using antagonist medication to push all the opioids off the research while their blood pressure, heart rate, and everything else is managed.
I have heard people say that they feel like going through the non-medically supervised bucket and blanket type of multiple days long, people think that it is a necessary step, that they will be less likely to relapse if they go through it because it's so uncomfortable. Now, personally, I haven't observed that. I've seen a lot of people who have seemed to be just as prone to relapse who've been through that process. I think addiction will drive you to that. But what do you say to that mentality, that the traditional?
I think that mentality keeps a lot of people from seeking treatment. I think that mentality allows people that just cannot make it through the withdrawal, allows to snowball on them, and they keep relapsing, using more and more, and their tolerance gets higher, and then they overdose. Even that the people that we see went through detoxification, medical detox, and again, I keep repeating medically assisted detox, because rapid detox is just a protocol for some people. Some people that are healthy, some people that have tremendous amounts of anxiety and cannot get through a withdrawal. Some people, they are taking drugs like methadone and Suboxone that has a very, very lengthy withdrawal. So for those people, rapid detoxification is wonderful. Medically detox is when we also have those patients in the hospital. The end result is the same. We'll get completely off opioid. The difference is how fast we did it.
And don't you think the resistance people have to the medical, I fear that goes back to reinforcing the idea that addiction is not medical, how it was treated as just a behavior problem back in the day.
100%. We have evolved immensely in science. 15 years ago, we did not understand chemistry of the brain like we do nowadays. So it was a lot easier to blame personality, DNA.
Yeah, a lot of the problems then are relegated to law enforcement rather than the medical community.
Correct. So if you're fully detoxed, all you're left with is yourself, your emotions to deal with whatever it is that led you to substance abuse in the first place. It's really, really important for people to know rapid detox so gets you from A to Z through the withdrawal while you're sleeping. With that said, to keep a healthy life, and that's for any of us, it takes work. Some of us more than others.
Part of a strategy to recover, not recovery all by itself. Important to say, I think, that not one element of treatment is not treatment by itself. It's just an element and a support.
You can have the proper diet, but you also need to exercise. It's just being a complex human being. The difference between recovering and being in recovery, that's for another time, because that's a long conversation.
And we're going to leave it there for today. Thanks so much for listening to the podcast. As Claire mentioned, our next episode is going to focus on definitions of being in recovery for addiction. What is the difference between being in recovery and recovering? And what does that all really mean? We're going to talk about that next time. If you have questions that you'd like us to answer about that topic or topics on a future episode, please hit us up with those questions. You can tweet the questions at Opiates on Twitter, or you can email your questions to info@opiates.com. Keep them coming, because remember, after all, where there's questions, there's eventually answers, and where there's answers, there's hope. The Waismann Method podcast is brought to you by the Waismann Method Advanced Treatment for Opiate Dependence. To learn more about the treatment, please go to opiates.com to learn more. The music that we have is the song Medical by Clean Mind Sounds. This show is edited and produced by Popped Collar Productions, where we bring podcasting solutions for business, entertainment, and nonprofit podcasts. Check us out at poppedcollar.net.